This meeting is very special because it really brings national and international experts together on a very short and very tight schedule, delivering the innovations, the frontiers, and how we're going to change the future. Not thinking about that the future is going to be there tomorrow, but already today, what is there as evidence to make a better future, treat our patients better, and make that differential change, that substantial, transformative change that the patients can have a better health, alleviating the pain, but also delivering higher quality of life. That is what this meeting is, its purpose. In urology, obviously. You can see at this meeting, and online you can look at the meeting. You're going to see there's a lot of things we discuss that are very, I would say, controversial topics, that are very challenging topics. And I believe experts talk here about technologies, concepts that will already in January, February, March make a difference. And then I think over the next, some of them will deliver in 10 years, as we can never predict how that change is going to in the clinical reality happen. But I think what you can see here is a glimpse of the future. And that is what is special about these meetings. And we touch on topics that normally are not heard at meetings because these are controversial topics.
First of all, I would like to express my gratitude for Professor Shariat, because it's really a great honor and privilege to be here. And as this is already a habit between us, because our predecessors, Professor Michael Marberger and Professor Imre Romic, they were very close friends to each other, and we would like to follow this connection between us. So we have been working together with the AKH and Vienna University and Semmelweis University, and really very much honored to be as an invited speaker for the Michael Marberger meeting. So I'm going to talk about a project which has been done together, and it was a cooperation between our universities, and this is to find the best predictive factors to predict the prognosis of prostate cancer, because there are increasing number of available drugs, but unfortunately all of these drugs, they will develop later on resistance, and then we would like to find the best available method and mechanism how to treat and how we can individualize the treatment for prostate cancer patients.
Of course, it's always a pleasure to join the meeting, which is always perfectly organized by Professor Shariat and all the team of Medical University of Vienna. During this meeting, we try to highlight all the main topics all over the year in urology and in urologic oncology. And today, my topic will be dedicated to modern laser technologies. We'll discuss thulium fiber laser, the technology that is becoming more and more widespread, and more medical centers all over the world use this technology. I hope we will shed some light on new aspects of this technology. I hope it will be interesting for all the visitors and the members of this meeting.
Professor Shariat is a dear friend and a pioneer in our field, and Vienna is amazing, and it's a pleasure to be here. Today I'm going to speak a little bit about the urologist versus the medical oncologist. Sometimes when managing advanced disease, there's a dilemma as to who should take charge and manage things. And I believe that the best approach is a team approach. However, we don't all have access to the same resources.
I've been back to this event for many years now, and it's really a highlight of my year. It's a pleasure for me to interact with Professor Shariat and his colleagues here at this meeting. Today I'll be talking about focal therapy in prostate cancer.
Today I'm going to talk about kidney cancer. This is my specialty, and I'm going to address the what has been published in 2022. I'm going to talk about the updates of the adjuvant trial. We are now in the adjuvant era where we can have an agent to use when patients have had surgery and are at high risk for relapse. I'm going then to address the first-line metastatic setting, again showing updates from phase 3 trials as well as new strategies in terms of triplets. And finally, I'm going to address the topic of biomarkers and the topic of non-clear cell histologies, and also the advances that were made with respect to rare diseases such as different Hippel-Lindau disease.
I chose two very controversial topic. The first one is testosterone supplementation in men with prostate cancer. I think that a lot of urologists still don't do it because they're afraid it's going to fuel the cancer. and we have a lot of evidence saying that at least it's safe. There's still a few indications in which we have to do clinical trial, but I think that's a paradigm which is changing. The other one is something that goes to my heart, and also I think to many of the academic urologists, is what is the future of academic urology? Because here in Vienna they have a very nice education program. It's not like this everywhere. So I wanted to give that very provocative lecture to see how do we urologists will construct our academic future, and I think here is the perfect crowd to do that.
Actually, I had a great opportunity to talk in this fantastic meeting. And my talk was about the post-prostatectomy incontinence. And actually, post-prostatectomy incontinence has a huge impact on our patients. And during my last 20 years experience, I saw many patients in this situation, and they're mostly tearing because of this problem. And I think the prevention is always better than treatment for such this condition. But I explained the different ways for treatment of mild to severe post-prostatectomy incontinence in here. And I talked about the surgical and non-surgical techniques regarding the control of incontinence in these patients.
This meeting is focused for all new advances in urology. I'm a stoneman dealing with stone disease, and in this meeting I presented the latest advancements in the stone management, minimal invasive treatment of stones, and new modalities. How should we apply them in order to make the procedures less invasive, bring the high success rates, and the complication rates how they can come down and down. This meeting is a very important meeting because not only for stones, also other parts of the urology, oncology, female urology, and peri-urology, all new advances will be discussed during the meeting. As I told you, I'm here to talk about the stone disease, new advancements, what are the real new game changers to make the procedures practical, safe, and successful.
The nice thing about this meeting is we see people again, which I know for 20 years. We've worked together, we've done a lot of projects, and yet new ideas come up every time. And it just perpetuates. You don't have to think as much, you just listen to them. Very good was that talk about the complexity of incontinence after radical prostatectomy. But you know, every talk has its interesting aspects, and it's a multiplicity, and there's a big variety of topics. So you learn.
It is really very good at the end of the year to summarize all the topics we had in uro-oncology throughout the year, and in bladder cancer particularly we had a lot of news, and we had new data on the antibody drug conjugates like enfortumab vedotin. We had the approval of the drug also in Europe, and I think this is exciting time for bladder cancer, and it is very nice to summarize and to have the data and to transfer knowledge and to transfer the treatment also now to our European patients. And I'm going to talk about FGFR inhibitors, and this is also an exciting topic because with the FGFR inhibitors, personalized therapy comes to bladder cancer. This is something new. Unfortunately, in Europe, we still do not have approved FGFR inhibitors, but in the US, erdafitinib was approved, and we are starting to test our patients to do genomic sequencing and to see if we can select patients for personalized therapy in urothelial cancer.
I'm from Prague, so we have very close cooperation with Professor Shariat, and it is really a great pleasure always to come here. And the meetings here are usually of excellent quality because Professor Shariat has a great talent to connect the people and to invite interesting people. So this is always a very top quality of the meeting. Concerning the topic of my lecture, I spoke about the future developments or some new developments and future plans for non-muscle invasive bladder cancer, particularly so-called BCG unresponsive tumors, which is a special category of the disease. And this is the area where appeared recently several new very ambitious treatments and very interesting treatments. They are under investigation, and we believe it will come in routine practice in few years, hopefully. So this is interesting topic, but I think we heard a lot of interesting lectures, and this is again after COVID restrictions. We again can share our knowledge and our interests. So it is amazing that we can be here and that we were invited here.
I was really impressed by the high quality content of the lecture, and it has been a marvelous afternoon, addressing many hot topics in neurology, and I had the opportunity to discuss about a comparison between traditional way of doing a nephroureterectomy and the minimally invasive technique, and I brought my concept that I really don't think that robotic nephroureterectomy is necessarily the best technique or the future for this surgical procedure. I personally come from a robotic center, and for the last 2 years we have been doing pure retroperitoneoscopic nephroureterectomy. Is a technique that we are developing, and we think that this technique combines being minimally invasive, so the concept of minimally invasive, in that you do the entire procedure with through laparoscopy with safety.
In this meeting, we discussed laparoscopic fluorescence-assisted laparoscopic partial adrenectomy in patients with benign adrenal tumors. So we discussed some possibilities of this operation, and I answered some questions. So I am very happy here. Then also in this meeting, we discussed many oncological subjects in urology, such as bladder cancer, kidney cancer, prostate cancer. So we update our knowledge about this issue. So again, thank you very much for inviting me.